Good afternoon, everyone, and welcome to today's webinar, Mastering Grant Writing and Securing Funds for Women's Health Initiatives, hosted by the Coalition for Women's Health in Africa. My name is Natasha Gilani, and I serve as the project manager at the Coalition. At COHA, we're dedicated to advancing women's health across Africa by empowering organizations with the knowledge and resources they need to drive impactful change. Securing funding is one of the most critical challenges faced by organizations working in this space. With the recent halt in US government funding impacting several health programs, it is more crucial than ever to strengthen our grant writing capabilities and explore diverse funding opportunities. That is why today's session is designed to provide you with the essential skills to craft compelling grant proposals, helping you effectively compete for funding and sustain impactful initiatives. We're very excited to have this engaging and interactive session ahead. Thank you all for joining us today, and let's get started. It is now my pleasure to introduce our esteemed speaker for today's webinar, Mr. Sham Musyoki from Maristops, Kenya. Sham is a public health specialist and a strategist with over a decade of experience leading health programs across Africa. His expertise spans maternal, newborn, child health, reproductive health, and health system strengthening. With a proven track record in policy advocacy, donor funded programming management, and government collaboration, he has played a key role in driving impactful healthcare solutions and fostering sustainable change. At a time when securing funding is more challenging than ever, his insights on mastering grant writing will be invaluable in helping organizations to access the resources needed to advance women's health initiatives. Please join me in welcoming Mr. Sham Musyoki. Over to you.
Thank you very much, Natasha, and I feel honored to be part of this session just to share what a master grant writing might be. So when this topic came in, I just decided to break it down into several sessions so that I'm able to guide or rather discuss through with the audience. As Natasha has well put it, I work with Maristops Kenya, which is now MSI Reproductive Choices Kenya. I mainly focus on health system strengthening on areas to do with sexual reproductive health. Just to start with, we have the understanding of the fundraising and the raising mindset, just to understand what this is all about. And we shall be able to talk through what a grant is or what a grant is not. And we shall go through some of the common myths and about grants, the purpose of grants, different types of grants, types of donors. I know this, many of you know different types of donors that we have. Also, we understand the grant seeking or the grant making cycle. Not all grant proposals are funded, and what should you do in case your proposal is not funded? And now the grant fundraising team. So those are some of the sessions that we shall be able to go through. And I know the main thing that is ringing in our mind is, why do nonprofits struggle with fundraising? And next slide, please. In non-governmental organizations, the non-profit making organizations, money is the oxygen. It is what drives them. And when organizations miss, or rather are without money, they asphyxiate, they atrophy, they fail. This is one of the things that one of the great people who talked about nonprofit management, that Jimmy Ross is an American entrepreneur and an author, talked about money being the main drive in the existence of most of the NGOs or the nonprofit organizations. And Seth Godin, international speaker, also talked about if you can raise money, then you are never going to have trouble getting a job in a nonprofit because that is their lifeline. That's the oxygen that makes them survive. So fundraising, or rather looking for money in NGOs, is a technique that is very vital for the existence of the same NGOs, but we have to understand what are these grants for. Are they for existence of NGOs? And if they are for the existence, in what purpose? How can we position ourselves to be able to align with these people who give the grants? Next session, next slide. There's no timeline, or rather, you can't say I've been writing proposals for this long. So there is an automatic leeway that your proposal will win when you write. So it doesn't take any experience in terms of grant proposal writing. You have to align with what the grantor, the donor wants. As you can see in riding a bicycle, how many lectures do you want to have so that you can ride a bicycle? Some might need only once, others several times just to be able to ride a bicycle. But for grant making or other writing proposals, you need just to be able to align with what the donor wants to be able to get these proposals right, so that you get the money. So it doesn't matter your experience, it doesn't matter how long you have been there, you have to align, you have to address what the grantor wants for you to be able to win these proposals. So it doesn't matter how long you have been in this field, you have to be agile, responsive to what the grantor wants so that you be able to win these monies in terms of grants. Next slide. So why do nonprofits struggle with fundraising? I hope this was more interactive. I can just get some answers from the audience. Just a why, you can drop it in the chat. Why do you think nonprofits struggle with fundraising? I know many people have many answers, but for the sake of time, I will just move and discuss through what I've come up with in terms of why nonprofits struggle with fundraising. Knowing who to ask. I have seen Margaret Casa saying knowing, just trying to know who are these people who are willing to give the money. Another, I'm just reading through the charts. Knowing who to ask, I've only seen one. Lack of network, lack of investment in relations, networking. Yeah, for the sake of time, we can go on and see the next slide. Sustainability. Despite having all these resources in your organization, people still struggle with fundraising. You have the resources, you have very resourceful people, you have the time, you have the money in the organization, you have the people, you have the experience, you have the technology, you have the management team in place. The beliefs and attitudes of the people are also very correct, very aligned to the mission and vision. They are very creative people, determined, they are love and caring support team, passionate about what you do, but still organizations struggle with fundraising. So why, despite these resources and resourcefulness, why do you struggle with funding? Let's go to the main reason why. Next slide, please. There is this conditioned thinking. People try to think just with what they have been thinking through over time. And remember, time has been changing. And also the donor profile, the donor priorities have also changed over time. So conditioned thinking is something that makes most nonprofits struggle with fundraising. How they used to do things in the past. 10 years ago or 20 years ago, the challenges that has been facing the health system, for instance, has changed. With having the pandemic that came out, the corona pandemic that was there, things have changed. They are now talking of resilience of health systems, sustainability of health systems, which was not a major focus in the past. And even the aspect of health has also evolved, not just looking at the main health, but also the other social determinants of health that are either connected or direct connected or indirect connected. There's aspect of universal health coverage, which has been there, but now is more amplified than before. So if you have the same thinking of 10 years ago, then you have to struggle with fundraising because the donors have also evolved and their priorities have changed. Scarcity is also a main thing. Out of just the preamble that was shared by Natasha, you have heard of USAID has frozen some of the funds. And also the fact that Kenya being a middle level country, also the donor profile has also shrunk to some extent. So the resources that are there are scarce and the people have to fight for those resources. So if you are writing a funding proposal, it has to stand out of the many others. So scarcity being there, this was not the case some years back. There was a lot of people wanted to fund Kenya and also fund projects in Africa. But with the situation, with other emerging challenges, donor profile and the priorities have changed with time. Others think fundraising is too hard simply because of their previous encounter. Either they have written so much and they are not getting a positive response to their proposals. Then they think then the donor fundraising is a hard field. And that also creates the mindset of nothing works, of which is more of a despair or giving up. Others think because we have done so much, we are not getting anything, then we don't deserve to be getting this donor funding. It's a mindset of just not able to press on or continue pushing the limits just to be able to get what is there. Donor fatigue. Others think the donors are fatigued with helping, but that's not the case. The case is donors have changed their priorities. Others who were so much concerned with health, they are moving to climate change. So they want to see how does your interventions in health help to handle climate change. So it's a matter of changing the priority and the focus, but with trying to find out what is the intersectionality between climate change and health. So the donor fatigue is not there. That's a conditioned thinking from your perspective, but it's a matter of you evolving in your thinking and having a broad way of addressing some of the issues which are facing the health system. And the other aspect is the getting rich quick, magic wand mentality. Like you want to get this money and you have nothing that is aligned with what the donor wants. So these are the conditioned thinking is the main thing why most nonprofits struggle with fundraising. So we have to focus. There is this thing of you have all these myriad of projections of what funding you need to be supported in terms of funding. But one thing you have to focus, where do you want the funding to go to? Are you aligned to what the donor or the grantor wants? So that is very key in addressing our conditioned thinking. Next. So what is a grant? I know many don't understand what a grant is. Can be given by an organization, a charitable foundation, can also be from an individual or another entity, but it's meant for a specific purpose, linked to a public benefit. So those are the very key areas, is specific purpose and for a public benefit. Unlike loans, grants are not to be paid back. So they have to identify priorities that would like to allocate that money towards. And these priorities have to be in line with what the grantor wants, and also should also be in line with what your organizational vision and mission. Because you won't want to go to an area that is not aligned to your vision and mission. That will raise concerns on what's your capability, your technical know-how to address those issues. Grants also differ from donations in that they tend to be much more general and flexible than grants. Grants are more specific, but donations, you can use it for general purposes, which might not be the donor, or rather the person giving those donations might not be so specific on, but grants are very specific. They are aimed at addressing a certain purpose, which is linked to a public benefit. So grants, donations, loans are quite different. And for the sake of this meeting, and now we are looking at grants, then we have to understand they are for a specific purpose and they are intended for a public benefit. We shall be able to know more about what public benefit is as we continue. Next. So why do grant makers give money? As I've said, it is an exchange of value, and this value is of social goods. So government fund ideas and projects to provide public services and stimulate the economy. So this social good should be something that is aimed at addressing a public health issue, or a public issue. Might not be really related to health, but something that is affecting the public as a whole. It's not meant for individuals or a certain section of a group of people, but should be aimed at addressing something that has been termed as affecting masses or a group of people in a community. And that makes it a social good. And because we are talking about health, it should be a public health issue. When an issue affects more than one person, then it becomes a public health issue. And that's what grants are for. And this public health issue should be aligned with what that grantor or the person giving the grants, it should be among the priorities of what that person wants. We shall be able to go through some of the grants that request for funding that are with very specific outputs. And these outputs, if you align them, or rather if you look them closely, they are related to a public health issue, which is affecting quite a number. Might be a community, might be a country, might be a section of the population, like adolescents, youth, young women. So that is what a grant is meant for. Next slide. There are some common myths about grants. And one thing, if something is repeated severally, doesn't mean it's true. Just like many say, two wrongs can't make a right. If something is wrong, whether it's repeated, how many times still remains a wrong. So whichever the myth, even if it has been carried over the years, can't make it true. And what are some of these common myths about grants? There are unlimited grants available for all purposes. As we have said, grants have a specific purpose. You cannot just go and get a grant and do anything that is not on the agreement. And that's why I said grants are a bit different from donations, even loans. Grants are free money, and they can choose what to do with it. This is not free money. Grants, as we have said, is an exchange for value. And this value is aimed at a social good. So you have to address that social good. You have to display, manifest that social goods. social good that you have been able to do with that grant. Grants are easy to get as long as you know how to write proposals. I've said experience doesn't make you, experience in writing grants cannot make you like your grants will be successful. That is not the case. You have to align with what the grantor wants. And they are not easy. As you have heard, the people giving grants, we have shrinking number of people who are able to get grants, organizations, and they are not easy to, you have to stand out. You have to make a very compelling proposal for you to be able to get this funding. Anyone can win a grant. It's not anyone. You have just to fill out the application and get a grant. And that's what we shall be able to see on the preparation for grant writing. It is something that you have to be deliberate, purposeful to write a grant, not something that you can wake up and say you are putting up a grant and the evening you are done and send. It should be something that's deliberate, well thought through for you to be able to get a grant. Grant writers can just take a commission of awarded grants to be and get paid. I don't know how you do your grant, the many organizations we have here, but one thing about grants, you cannot get somebody to write for you a proposal, and then the reward is a commission, or rather you get a percentage of what the award is. Because this is not the way it works. As we will be able to see in preparation of grant writing, you need a team, not an individual, a team. And this team comprises of several other people who will play different parts in the grant writing so that you are able to get a well, outstanding, and compelling grant for funding. Next slide. I know people who own organizations, who run organizations, who have organizations, they want these grants just to be able to make sure they exist in terms of just the general operating expenses, capital expenses like getting buildings, paying for rent and such. But grants have nothing to do with that. People don't want to fund your existence. They want to fund your impact. So one thing that people should understand when they are writing grants, the specific purpose of grants is for social good. And a part of that social good is not existence of a certain NGO. No one wants to fund your existence. They just want to fund your impact. And that's why when we go to any networking meeting, you don't come and say how much you run in terms of overhead expenses, your capital expenses. You only talk about your impact. How many lives have you been able to touch? How many maternal deaths have been averted? How much have you done just to improve the social health of the people that you serve? So the existence of the organizations is not in the mindset of grant, people give grants. And this is very key. And even nowadays, I think they are also limiting how much money should go to these general operating expenses. If they say these general operating expenses and capital expenses, they will give you a percentage, can only go with 10%, can only go with 15% of their grant money. And that has to be strictly adhered to because they don't want to fund the existence of a certain group or an organization. They want to fund your impact in terms of the social good of the community. Next session, next slide. Now, common myths about grants. Fear of failure comes in many shapes and forms. It is not about writing one perfect grant that brings you the golden ring. We will only pay the grant writer when he gets. These are some of the myths, and we only apply to places we are likely to win. As I've said, experience what you have been able to do before cannot make you win a grant. Because if you write one, there's no perfect grant writing. What we can say is an outstanding grant writing proposal, but there's no perfect grant. And I've said you can't get somebody to write a grant, then you pay. Grant making, or rather grant writing proposal, it starts too early from the preparation as an organization, all the way to the actual writing. So all these are some of the myths, and I've seen people, organizations even having to get consultants to come and write grants for them. And these consultants are not even aligned to their mission and vision of that organization. So automatically, the grants are meant to fail because these are outsiders. They don't know the mission, they don't know the vision. They are even not in line with what you have been able to accomplish before. So you can't get just somebody who will help you write a perfect grant. There's nothing like a perfect grant. So you have to have a team that is working within the organization, that understands the organization, that is able to bring in ideas and write a grant that is outstanding, not perfect, outstanding according to what the request for proposal is based on. Next. More common myths about grants. One, grants management starts after the award of the grant. I've said this. It starts way from the preparation. After reading that request for proposal, funding proposal, there is where the grant management starts. If your proposal is rejected, you should just move on to the next funder. That's not right. Some of the proposals are not rejected for the purpose of not being fit. There are several reasons why a proposal can be rejected. And just moving on to the next one without finding what made this one being rejected is not one of the best ways to handle most of the grants. It is not easy to quickly pull together a grant application. It is easy to quickly pull together a grant application. As I've said, the preparation starts early. You need a team. You need timelines. And I've said you can't just see a grant request and in the evening you have already put up something and you are ready to send. You have to quickly prepare so that you can address the issues raised, or rather the priorities of the donor. It is not a one-man show. Grant writing is not a one-man show. It needs a team. We shall be able to see the team members of our grant writing team and what are their functions so that we understand it's not a one-man show. And a tough economy means only there is no money out there. There are so many people who are out there who are ready to give money, but we are not aligned. As many NGOs, we are not aligned to their priorities. In some cases, we even don't know whether they exist. So it's a matter of being able to network, being able to shout what we have been able to accomplish through our networks, our social media, and also attending some of these conferences where you are able to showcase and just show what you have been able to do. A tough economy does not mean there's no money out there. There are so many people, philanthropists, who are ready to give money, but they don't know where, how much to who, unless you showcase what you are doing and what social good you are doing in the community. Next session. So types of grants. We have two types of grants. One is very competitive, the other one is non-competitive. We can classify them as reactive and proactive. So the reactive ones is whereby there is a call for a proposal. It is sent out there for people to apply. And this one is not very easy to influence the investment or how to influence the grant. It is usually very highly competitive with a very, very short turnaround time. Just like a period of almost like 2 weeks or a week for you to apply. Prior relationship with the donor is not necessary, and potential to rapidly build networks and profile. If you are able to do this one, to apply more of these reactive grants, which there is the call for proposals, you are easily able to build networks because you are like looking at who have previously been funded by the same, how has been the experience. Some even go and build like partnership, a consortium for application. So that one is very easy to build a network of like-minded organizations to apply for these reactive grants. For the proactive ones, is whereby you meet a group of people, philanthropists, people who are able to give money, and you just sell your case so that we have the idea. You sell your idea to the donors so that they can be able to fund. This one is usually not competitive because it's like coming out in a place, you just showcase what you do, you have your ask, and the donor, if he's interested, will come and decide to give you the funds to run or rather to fund that particular project you have sold to them. It takes a long time to bear fruits because you have to be very consistent. Honesty, patience has to be there. And it leads to long-term and mutually beneficial relationships. And you will find that most of the foundations, they usually go through these kind of proactive grants, whereby if a relationship is built between you and the donor, they are there ready to give you more funds as years go by, simply because of the relationship that you have established during since your first encounter with them. And the other thing, in this one, you have to align with the NGO's mission so that the donor feels your priorities are priorities in terms of what you do in the mission and vision of your NGO. In this one, you'll find that grant writing capacity is not critical. Some even decide to give you money, like take those $300,000, write something that you think you can do with it. So the money is there, you just have to write a very quick concept on how much you are going to do, what you are going to do with that money. So proactive, they are rare, but long-lasting. Reactive, there are so many of them, very competitive. And they are the ones that you find they are very common in our setting. But if you get the proactive ones, you build relationship and you are assured of continued relationship with that donor for as long as your mission and the vision aligns with the donor priorities. So those are different types of grants. And I know the aim of this Zoom is more focused on the reactive kind of grants, which are highly competitive. You need to have those skills in grant writing. You need to stand out from the others so that you get these grants. But in either way, they are important. And I think the cross-cutting thing is you have to align with the donor priorities and also with your NGO mission and vision, just to be able to get the grants. Next session. Just to dwell more on these restricted funds and unrestricted funds. The restricted funds are the competitive grants, the reactive grants. They are for specific purpose and defined in the agreement. And the unrestricted ones can be used for any legal activity, anything so far as it's not illegal. And these are the proactive ones. The ones we saw they can be from either events, you go for a tournament, you raise some money, you go for marathons and such, online donations, surplus for social enterprise, like the social, the community, the ones you get from the people just for the social responsibility from the corporates that we work with, in-kind donations, all these are unrestricted funds. And I know there is not much problem. The problem is on the restricted funds, which are highly competitive, and also they are meant for specific purpose which is defined in the agreement. Next. So I won't dwell so much on these types of grants. You have been able to hear the government agencies, you have USAID, CDC, foundations have talked about that, corporate giving programs, the corporate social responsibility. The other NGOs also give grants to others, like there is the Clinton Health Access Initiative who also give grants to other NGOs and such. So I won't dwell much on the types of grant makers. Next. Common terms, I think you have been able to go through this. Some call it funding opportunity announcement, just the call for proposals. Others request for proposals, others request for applications, call for applications, the CFS, notice of funding opportunity, express of interest, letter of intent, and letter of interest. All these are some of the common terms used, especially for the competitive type of grants, the reactive kind of grants. So all those just mean the same. Next. So top reasons why grantors deny funding. Grantors deny funding because first, especially the competitive ones, they have a definite number of money they can award in a cycle. They are programmed, like in this year, we are only giving this much of money. So by so doing, it means they are highly competitive because they will get so much applications, but the money is set for that year to be applied for. And the other thing is, if the requests mostly often exceed what the grantor's budget is, then that's a direct rejection. The other thing why grantors deny funding is on technical basis. Your proposal might be technically right to a specific grantor, but you have not just aligned to the grantor's priorities as closely as they would have been liked. So the technical part, you have done it very well, it makes sense, but the priority of the donor is different. You are technically right, but aligning to the priority is the issue. So this now becomes, you are denied the funding just because of just not aligned to the priorities. So you have to be technically right, whereby we have so many technical people who are contributing to the grant, but is the technical part addressing the priority of the donor? If it is not addressing the priority of the donor, then there is high likelihood that will be turned down. So those are some of the reasons why grantors just deny funding. One, they have limited number of resources in terms of how they have planned it. The pocket of money that they have decided to give that year is this much, but you end up applying for more. Then that gets it thrown out. Also, there are so many other people who are doing the same. If it doesn't stand out, it's also thrown out. You might have written a very technical, sound kind of proposal, but it's not aligned to what the grantor wants in terms of priorities, given priorities, that the grantor will not fund it. And that is what brings a lot of fatigue to people, because they say, we wrote a very nice proposal, technically sound, but it was turned down. Did it align with the donor priorities? That's the biggest question. Next. So top reasons still continue. Quality of proposal. There are some things which might look very minute, but they can contribute to your grant, to the donor denying you funding. Things like page limits, margins, just failure to follow the grander guidelines. Poor written communication skills, not clear, concise, and compelling kind of language can also turn down that. And a weak program design, that's very, you have to have a program design which is concise, not vague, not overambitious. You also have to articulate the strategies very well. And also, the lastly and not least, there should be some sustainability aspect in all the projects that you do, or all the write-ups that you do. And the other part that's also under the quality of proposal is the overlapping efforts, like creating competition in already crowded field. For instance, if it's about addressing maternal deaths, you always go back to training and training and training of healthcare providers. This is something that has been done over and over again since when maternal deaths started happening. But do you mean is an aspect of capacity of the healthcare providers to address maternal deaths? Is it only thing that is contributing to this maternal death? So you have to think through and come up with something that is agile, strategic, that's addressing so many other factors that contribute to this, ranging from the community aspect, socioeconomic empowerment, capacity building, something that is holistic. But if you keep on just writing the normal things, then the quality of proposal is disregarded. And then we have the dollar chasing, whereby you want to write any proposal which is even out of your mission and vision, like smart agriculture, and you are only dealing with women health. We want to write proposal talking about climate change, planting of trees, but your focus, your mission and vision is all aligned to improving maternal health. So these are meant to fail because they don't align. And your interest more is just getting the money, and yet the capacity, the mission and vision doesn't align. Next slide. So 4 reasons every organization needs a strategic plan. One is the mission and vision should be aligned to every proposal that you write. If the proposal, the grant request, or other request for proposal priorities are not in line with your vision and mission, please don't waste time applying for such a grant. The other thing is to prioritize decisions about allocation of resources to new and existing programs. If you have been running a program and you have this call for proposal, if the program has been running, can you show how you will be able to scale up that program other than now writing as if you are writing a new one? Because one thing that most donors or grantors want to see is what has been your previous work? How are you planning to scale up? What is the sustainability approach? Do not prioritize allocation of resources to new grants or existing grants, and yet there are some running programs which are also in the line with what you want to apply for. You have to showcase what you have been able to do so that you see how you can scale up the same. If they see the scale up aspect and the impact that you have been able to do with the already existing ones, they will be able to fund more for that. If you want to start new, you have to have a baseline of why you want to do that based on what you have been able to learn from any other program which is related. Focus on fundraising on the issues and audiences that are of greatest importance to your future. And this future is more of the social good. Do not look at existence of your NGO. No donor or grantor wants to fund your existence, wants to fund your impact. So can you have your strategic plan that shows your impact in terms of social good, or rather addressing the public health issues? You can also share your big dreams with donors and prospective donors and prospective donors, demonstrating how you have been how you have a legitimate path to accomplish your goals. You have to have a strategic plans. Most donors will ask you, what is your 2030 strategy? What is your organizational strategic plan for the next 5 years? What are you seeing your organization doing? And as I've said, please focus on the social good, the public health issues. Don't focus on the existence of your organization, because no donor wants to fund your existence. Next. What should you do if you are not funded? I know this has happened to nearly all the organizations. Your funding proposals do not go through. You get a feedback that they can't continue with your proposal because of certain issues. Please let them know you appreciate the opportunity to apply and look forward to exploring future partnership opportunities. You can even go further and just call the program officer or request a feedback, a specific feedback that can strengthen your proposal. You can ask, why was it turned down? Why did you not win this grant? They will give you a specific feedback, which will also help you build a future stronger proposal. And also accept all feedback graciously. Avoid arguing or making excuses. Arguing will not increase your chances for future awards. Instead, you risk being alienated by potential donors, because donors, one thing, they communicate across each other. They will ask, have you funded such an organization? What has been the experience? They will also talk through them. I think I do know that they have a network of donors whom they are able to exchange ideas, exchange past experiences with different organizations, and that will also determine whether they give you some donor funding or not. So avoid those excuses, arguing, build a rapport with them. And you never know, they might be the people who will fund you in the next call for proposals. Be humble and implement any changes that is recommended by the grantor, and seek ways to strengthen the relationship with the grantor. Because the moment you start now having that exchange, feedback, requesting for more feedback, trying to know where you went wrong, by so doing, you are even broadening your network. You are making yourself well known to that donor, so that next time when there's a call, you will be a person of interest to that donor. Next slide. What to do if not funded still continues. Update and resubmit the proposal. Ask the funding source that you applied if you can resubmit. Some get a proposal feedback which needs some more additions or some issues that need to be addressed. Go ahead and ask if you make those changes. Can you resubmit the same? Just ask. Don't resubmit before asking. You just have to ask and know whether you are still eligible to resubmit if you make the changes that they have proposed. You have to update and tweak the proposal to submit it to another open grant solicitations. Don't think if the grant proposal was turned down by grantor A. And the grantor B comes up with the same, or rather something almost close to what you had applied for. You can always work on your initial proposal, which was turned down, with the recommendation that were asked by the grantor, and then we submit the same to the new grantor. So it doesn't mean if something was turned down, it will be turned down throughout. You need just to update and tweak it just to align with the new grantor priorities and resubmit. Repurpose the proposal for other funding streams. You have to have like a store, a database, a repository whereby you can store all these proposals you have written through over and over, and you never know, they might be coming handy when it comes to new grantors. So please repurpose and have them stored in a place ready for just tweaking and updating for new potential grantors. Next. So I think the session focused mainly on why do grantors give money? Why do nonprofits struggle with fundraising? Number one reason why grantors do not award funding, and two main categories of revenues for nonprofits, that's the grant types of grants, and also why you should do if you are not awarded the grant. I think that finishes our first session, and I can see the time is much gone. I know I have two more presentations. Maybe I can just get some reactions on the same, or you intend to continue. So we have the case for support. I think it's quite short. We can just go through it very fast. So we want to see what's case for support, okay, statement. How do you develop one? And also we want to, then you have different organizations can see, or now they can come up with their case for support. I think I have drafted a guide on how you can come up with a case for support. And this case for support mainly enables us, like, if you are given like 30 minutes with a group of donors, what can you press, how can you give up, or rather, what can you say to them just to build a case for them to feel the need to support you in that endeavor? So you can just go through it very fast and see. Next slide. So what is a case for support? It's just a piece of communication collateral that helps prospective donors understand why they should give you money. And this one should focus on a specific fundraising goal. Like you can be a capital campaign to fund a new facility. For example, it can be a simple encouragement to donors just to give operating support to your organization to support all its activities and initiatives. So you have to have a case for support. You should have a specific goal that you need to address. And we shall see the different parts of the case, building a case for support. Next slide. So what is a case for support? It has different areas that you should know about them. One is an investment prospectus. It's like calling people to invest in a certain thing, that a specific goal that you have in mind. And it also helps to answer some basic questions about a problem. That problem you want to address, it is whatever you want to address, it should be able to ask to answer some basic questions about that problem that you have already placed out there. and must be supportable and defensible. What that means, it should be backed up by data, by a story, a human interest story, or an experience that you have had in a certain community. It should have broad implications to the community. As I've said, the social good cannot be left out in NGO, non-governmental organizations, non-profit organizations. Should be addressing a social, public health issue, a public health thing that needs to be addressed in the community. It should be having some attachment to the audience, some emotional attachment, something that will touch them. Like most of the human interest stories, they tend to have some emotional attachment to the people. Like giving a story of a girl who was not able to either achieve her goals in life simply because she missed basic education, or she got pregnant when she was very in early life, and she dropped out of school, and those things, and out of those circumstances, she was unable to achieve her goal in life, and this affects a whole family. You can also talk of what you have been able to do, like intervening in such situations, like keeping girls in school, how you have changed the trend of girls dropping out of school because of some sanitary kind of support. But you, through interventions, you are able to keep girls in school, and these girls are able to showcase what they have been able to achieve in life simply because of your interventions early in their education life. So something that is touching, emotional touching, really can drive, or rather drive your case for support. You must be very optimistic, hopeful, show how much that can bring up to a greater community, greater social good. Should be very brief, easy to remember. Most of the cases like a one-pager, and they should move people to action. As I've said, after you give this case for support, should make people feel connected and wanting to support you in that statement. So those are some of the what a case of support looks like, but we shall be able to deal more on what are the key elements. Next. So who develops the case for support? It's a team, a fundraising team. You can call it a fundraising team, a proposal development team, or whatever you want to call it, but it should be a team. One person cannot do it. And this team, you can call it like a head team, both internal and external stakeholders might be involved. And a significant portion of your fundraising should focus on stories of the people, communities, and your organization that you serve. As I've said, human interest stories touch more than just mere statistics. If you are able to give the stories from your locality, where the organization is based, community stories, where you are, that can move the donors. You can also ask the beneficiaries of their guidance on how they want to be represented, like the community that you are. Some have ended up coming with the beneficiaries to these forums, whereby the beneficiaries will talk about how they have been able to benefit from the organization. And also it's good, we call it the co-creation, whereby you have to be part of that community. Let the community come up with solutions, adopt those solutions, magnify them. Let the community feel part of that. And some even can come as beneficiaries when you are having this case for support audience, or rather when you are giving out this call for support in a forum. Next. So we have the elements of case for support. One is the problem. The problem is the essential problem you need to alleviate in the community. And this has to be something that grabs the attention of the reader or the audience. The what? What problem are you trying to solve? And I've said you can present this problem either by giving a story of the locality, the community that you stay in. For example, in community X, we have so many single mothers. Why do we have so many single mothers? You can talk of many of them drop out of school because of pregnancies. They end up being single mothers. And also this has been driven because of the other gender and social norms in the community. And just showcase and what the problem is. There is a lot of poverty leading to teenage pregnancies. They end up being single mothers, and the vicious cycle of poverty continues in that community because of just those aspects of social norms, gender norms, poverty, and such. So that being the problem, you have not just indicated a mere number. You are connected to a real life situation that is happening. This is different from saying in country X, we have 14% of teenage pregnancies. That's a statistic and it is well known. But people might not connect themselves to that. But if you give a story of a certain mother who became, a certain adolescent who became pregnant, went out of school, became a single mother, is now unable to have a livelihood, then that people are able to connect to that. So have that problem connected to the emotion, try to emotionally connect with the audience by putting a human face into your story. Opportunity, this is the how. What response do you want to do to that kind of problem? What do you have? What impact practice do you want to put in place to make sure you address this issue? Then reinforcements. You can, what accomplishments show the effectiveness to respond to this opportunity, or rather this, the problem that you have already highlighted. And this comes out in a way that if you have been able to do such projects addressing such issues, you can showcase what has been your impact in the previous year in terms of addressing teenage pregnancies, keeping girls in school. These are some of the reinforcements that you can come up with just to reinforce your high impact practice as an opportunity that you have done before. Then the plan. This is the how. You now go deep into the how. Describe the plan to respond to the problem. We know we had the opportunity in the response whereby you said you will do 1, 2, 3, but how are you going to do this? For instance, we can talk of gender-based violence. It is more prevalent among adolescents or young children. And you say you are going to use play, just the normal play, to address the aspect of gender-based violence among children. When you come to the plan, you have to now show how does the plan, how does the play address the gender-based violence among children. I've said the opportunity is the play. The how is the play. The problem is the gender-based violence among adolescents. The opportunity is the play. Reinforcement, I said you have to showcase what I've been able to do before. The plan is now described. How does play handle this gender-based violence among children? For example, they say children are unable to express themselves. They are not able to talk. They are not able to stand and say what they are going through. But through playing, they are able to be more social and explain what types of problems they have been going through. So play has now been broken down as a language which the children more understand and are more free to express their issues. So the how, you have to go deeper in terms of the plan to showcase how does that play under gender-based violence among children. Then we have the costs. Be realistic. The budget should be very realistic. Don't come with a vague figure of amount of money you want to spend. If you are told to explain the budget, you should be able to explain it in an explicit way which is connected to the problem, to the opportunity, and the plan. And on top of it all, sustainability is very key. Have a business plan kind of budget that shows this will be able to go beyond the funding cycle. Timing, show how this is very urgent, like how many children are either dying out of gender-based violence. You can break it down even to the level of an hour a day, other than saying last year we had like 200 children who have been victims, not survivors, victims, or who are already survivors. Then can you break that down of how that urgent is every day? How many children are facing gender-based violence? They will see the urgency and support you in doing so. The people whom you are working with, this is very important. We know we don't operate in a vacuum. We operate in a system where there's Ministry of Education, we have other players, we have other collaborators, we have referees who are working together, who can recommend you as one of the organizations that is key in addressing gender-based violence. So can you show that whom you are working with? The main stakeholders in health, the main stakeholders in education. How have you been working with them? How are you collaborating? So that will also build your case. Then the appeal, what is the ask? What you need them to do now? So you have to ask, your ask should be very concise, direct, and also showing the urgency of that ask so that they can be able to fund you in promptly. And also the ask should not be very vague. Like if somebody asks you, what did she really want us to fund? That should not be the case. They should go out knowing she really wanted this to do 1, 2, 3, because you were very concise and direct to the point. The ask should be very clear and easy to remember. Next. So this is something that I leave it for you. I've been able to give examples. As different organizations, you can come up with your case for support, just following that format. And it should be a one-pager. I know you have the issues that you have been working on, the public health issue. Be able to just write following those different elements, key elements, so that you can have a one-pager and we can review it during our next session, which I think we shall be able to plan with the conveners of this webinar. So thank you very much. I would like to ask for any question. Any question and clarification about what we have been able to go through?
Thank you, Sham, for that presentation. I think a few questions have come up. We have one from, let me see, Christabel. What can you do when you do not receive feedback from a grantor when you are not successful even when you ask for it? I don't know if that question came out clearly.
I think she's asking, you have asked for it and you don't get feedback, right?
Yes.
Maybe the model, there are different ways of communicating with that donor. Might be there is a call, or you can visit the organizations or the email. But if the feedback is not forthcoming, it just means you need just to look for other ways of reaching out to the same organization just to know what really happened. But I know most of them will be able to give you feedback. And also, you can also find out whom they have been able to interact with before, and just to see what is their interest in terms of their proposals. So I think that's all I can say about it. But more so is just making sure if you don't get, you are not successful in your proposals, please be gracious enough just to thank you and also ask any specific feedback why the proposal never went through. If it's not forthcoming, then it's okay. You can always look for another time.
Okay. Thank you so much, Sham. We have another question from Charity Madenge. If the amount requested for is higher than the available amount, isn't there a room to negotiate, maybe to run a project in phases, a real partnership, not just thrown out for asking for more than what is available?
Remember, grantors are looking for opportunities to narrow down the so many applications to the just a sizable amount. So you have to conform to what they have placed out as the call, the amount of the proposal. You can't go beyond it. And even going below the amount they have asked for is also another red flag, because you seem not to be very keen on your budgeting and your keenness on what they have placed out for. So it's good just to do the amount as per the request in the request for funding. And in case, you can also go ahead and see the aspect of co-funding, but the amount has to be what they have placed out. But on the aspect of sustainability, you can show the aspect of co-funding if you think the amount will go beyond that. Just show the aspect of co-funding, but let the budget that you send to that donor be exactly what they have said in their call for proposals.
Thank you so much. I think that's all we have questions. That's all the questions that we have on our chat box. I don't know if you have anyone that would like to turn on their microphone and probably ask the question live. Great. I see we've not received anyone asking the question live. Thank you so much. Thank you everyone for joining us. This webinar has been a very insightful one. We've been able to tackle different aspects of grant writing. It's always a tussle to draft a proposals and get awarded the grant, but here with Sham Musyoki, he's been able to break it down for us. And of course, this session will be in phases. He's been able to tackle the first aspects of grant writing proposals. And of course, given the feedback that you also given on the chat box and what you will share after this on your feedback forms, we'll be able to continue with the whole session. Again, this session has been organized by the Coalition for Women's Health in Africa. We basically a membership-based organization that brings non-state organizations together just to tackle the issue and enable women and girls access equitable healthcare across Africa. And thank you all for joining us. I would like to take you through a little bit about Africa Health Business Symposium that will be on 16 to 17 July in 2025. Please have a look at the website. So basically, we discussing on a theme around leveraging the innovation to advance universal health coverage in Africa. Basically, assessing what are some of the challenges, how far are we in attaining the universal health coverage, which was set during the Sustainable Development Goals. Thank you everyone for joining us. My name is Elizabeth Chalo. I'm the project associate at the Coalition for Women's Health in Africa. Thank you. It was a pleasure interacting with you. As if you'd like to reach out to us, Coalition for Women's Health in Africa, please have a look at this slide. You can always find more details on what we do at our website, coa.net. If you'd like to learn more about South African Health Symposium, please have a look on the link that I've shared in the chat box. Have a lovely day from wherever you're joining us. Thank you for joining us. It was a pleasure meeting you all.
Thank you.
Thank you, Sham, for joining us.